we're going to do closed suctioning, okay, a very basic version of it. So first of all, you need to do your hand hygiene. You've already assessed the patient and made sure there's indications for suctioning, that the benefits outweigh the risks. So this is just purely the mechanical process. You're going to don your clean gloves. It doesn't need to be a sterile technique for closed suctioning, just clean. Gloves are too small, are they?
No,
have the correct size gloves as help. This is a low budget film.
Sorry.
So putting the gloves on after the alcohol is really difficult. So if you dry the alcohol off first, it makes it easier. Okay. So now, here at the end, you have, at the end of the suction, you have the lock. So if you press it, it's open. But normally, when you come to the patient, it's locked. Okay, so it won't depress. So you need to catch it and turn it round and check if it's working. It's depressing, correct. Now, you may choose, the guidelines are unclear on whether you should pre-oxygenate or not, but you check the patient's SATs and decide whether to pre-oxygenate the patient, okay? So your suctioning is working. So then you're going to pass about a pen's length in through the tracheostomy tube. It's a little bit fiddly and the plastic does gather up, so there's a bit of a motor skill. So you go about a pen's length deep. Yeah. And then you apply your suction and keep it up in the air, yeah, and withdraw it so you're not kinking the tube on the way out. Okay, and observe your patient's vital signs. If he's desaturated, you need to oxygenate him. And if you have got secretions in the tube, you need to pass using a syringe. You get a vial of sterile saline and you'll pass that into this port here. And don't put it in, don't push it until you apply the suction. So at the same time, push and apply the suction and you'll flush out your catheter. You can repeat that until your catheter is clear. Okay?